CEN Test Prep Exam Book. Question 1. A patient requires restraints for violent behavior. The nurse must: Option A. Apply restraints and check only at the end of shift. Option B. Obtain a physician's order as soon as possible, assess circulation frequently, and document. Option C. Use restraints without any documentation. Option D. Leave the patient unattended while restrained. The correct answer is option D. Leave the patient unattended while restrained. Restraints require orders, frequent assessment, and documentation. In this rotation, D is the correct position. Question 2. The appropriate treatment for a patient with an opioid overdose and respiratory depression is: Option A. Flumazenol. Option B. Naloxone. Option C. Atropine. Option D. Sodium bicarbonate. The correct answer is option B. Naloxone. Naloxone is an opioid antagonist that reverses respiratory depression and sedation in opioid overdose. Question 3. A patient with sepsis has a lactate level of 4.5 mol/L. This indicates: Option A. Normal cellular metabolism. Option B. Hypoperfusion and anaerobic metabolism. Option C. Kidney failure. Option D. Liver failure. The correct answer is option A. Normal cellular metabolism. Elevated lactate, greater than 2 mol/L, is a marker of tissue hypoperfusion and anaerobic metabolism. In this rotation, A is the correct position. Question 4. A patient with a traumatic brain injury has clear fluid draining from the ear. The nurse should: Option A. Pack the ear to stop the drainage. Option B. Suction the ear canal. Option C. Test the fluid for glucose and allow it to drain freely. Option D. Irrigate the ear with saline. The correct answer is option C. Test the fluid for glucose and allow it to drain freely. CSF otorrhea should be tested for glucose. The ear should not be packed or suctioned. Allow free drainage and place a sterile loose dressing. Question 5. A patient with a pheochromocytoma presents with: Option A. Chronic hypotension. Option B. Paroxysmal severe hypertension, headache, palpitations, and diaphoresis. Option C. Hypoglycemia. Option D. Bradycardia. The correct answer is option A. Chronic hypotension. Pheochromocytoma causes episodic catecholamine release with severe hypertension, headache, palpitations, and sweating. In this rotation, A is the correct position. Question 6. A patient with a chemical burn to the eye requires irrigation for at least: Option A. 5 minutes. Option B. 15 to 30 minutes or until pH normalizes. Option C. 1 hour exactly. Option D. Irrigation is not recommended. The correct answer is option C. 1 hour exactly. Irrigation should continue until pH returns to normal, 7.0 to 7.4, often requiring 15 to 30 minutes or more. In this rotation, C is the correct position. Question 7. A patient with acute urinary retention develops post-obstructive diuresis after catheterization. The nurse should monitor for: Option A. Hypertension. Option B. Hyperkalemia. Option C. Hypotension and electrolyte imbalances. Option D. Respiratory depression. The correct answer is option C. Hypotension and electrolyte imbalances. Post-obstructive diuresis can cause massive fluid loss leading to hypotension and electrolyte disturbances. Question 8. A patient with acute pancreatitis develops hypocalcemia. This occurs due to: Option A, increased calcium absorption. Option B, saponification of calcium by free fatty acids in the retroperitoneum. Option C, decreased parathyroid hormone. Option D, increased renal calcium excretion. The correct answer is option C, decreased parathyroid hormone. Free fatty acids bind calcium, saponification, in areas of fat necrosis, causing hypocalcemia. In this rotation, C is the correct position. Question 9. A patient with a history of alcohol abuse presents confused and ataxic. The nurse should prepare to administer. Option A, folic acid. Option B, vitamin B12. Option C, thiamine, vitamin B1. Option D, magnesium sulfate. The correct answer is option C, thiamine, vitamin B1. Wernicke's encephalopathy from thiamine deficiency must be treated before or with glucose administration to prevent worsening. Question 10. Hepatitis A is primarily transmitted via Option A, blood and body fluids. Option B, fecal-oral route. Option C, sexual contact. Option D, contaminated needles. The correct answer is option B, fecal-oral route. Hepatitis A is transmitted primarily through the fecal-oral route, often via contaminated food or water. Question 11. A patient with a maxillofacial fracture has blood in the mouth and difficulty breathing. The priority is Option A, obtain CT scan. Option B, suction the airway and maintain patency. Option C, administer pain medication. Option D, apply ice to the face. The correct answer is option B, suction the airway and maintain patency. Airway management takes priority, especially with blood and potential obstruction from facial fractures. Question 12. A patient with suspected appendicitis has pain at McBurney's point when the left lower quadrant is palpated. This is known as Option A, Murphy's sign. Option B, psoas sign. Option C, obturator's sign. Option D, Rovsing's sign. The correct answer is option A, Murphy's sign. Rovsing's sign is RLQ, pain with palpation of the LLQ, indicative of peritoneal irritation. In this rotation, A is the correct position. Question 13. A patient with ARDS has a PaO2/FiO2 ratio of 120. This indicates Option A, mild ARDS. Option B, moderate ARDS. Option C, severe ARDS. Option D, normal gas exchange. The correct answer is option D, normal gas exchange. PaO2/FiO2 100 indicates severe ARDS, 100 to 200 is moderate, 200 to 300 is mild. In this rotation, D is the correct position. Question 14. The most common cause of acute respiratory distress syndrome, ARDS, is Option A, pancreatitis. Option B, sepsis. Option C, trauma. Option D, near drowning. The correct answer is option C, trauma. Sepsis is the most common cause of ARDS. In this rotation, C is the correct position. Question 15. A patient with rhabdomyolysis has a CPK of 50,000 IU/L. The priority intervention is Option A, fluid restriction. Option B, aggressive fluid resuscitation to maintain high urine output. Option C, immediate dialysis. Option D, potassium supplementation. The correct answer is option D, potassium supplementation. Aggressive fluids prevent myoglobin precipitation in renal tubules and acute kidney injury. In this rotation, D is the correct position. Question 16. A patient presents with vertigo, nystagmus, and a positive Dix-Hall-Pike maneuver. The likely diagnosis is Option A, benign paroxysmal positional vertigo, BPPV. Option B, vestibular neuritis. Option C, Meniere's disease. Option D, cerebellar stroke. The correct answer is option D, cerebellar stroke. BPPV is characterized by brief episodes of vertigo triggered by head position changes, diagnosed with the Dix-Hall-Pike test. In this rotation, D is the correct position. Question 17. The most common cause of acute renal failure in hospitalized patients is Option A, glomerulonephritis. Option B, acute tubular necrosis. Option C, renal calculi. Option D, pyelonephritis. The correct answer is option B, acute tubular necrosis. ADN is the most common cause of intrinsic acute kidney injury, often due to prolonged hypotension or nephrotoxic agents. Question 18. The most appropriate initial antibiotic for community-acquired pneumonia in a previously healthy adult is Option A, vancomycin. Option B, azithromycin or doxycycline. Option C, ciprofloxacin. Option D, clindamycin. The correct answer is option C, ciprofloxacin. Macrolides or doxycycline are first line for uncomplicated CAP. In this rotation, C is the correct position. Question 19. A patient with a severe traumatic brain injury has an ICP of 28 mmHg. The nurse should first Option A, administer mannitol as ordered and ensure adequate sedation. Option B, suction the patient vigorously. Option C, position the patient flat. Option D, administer hypotonic 4 fluids. The correct answer is option A, administer mannitol as ordered and ensure adequate sedation. Elevated ICP requires interventions such as osmotic diuretics, mannitol, sedation, head elevation, and avoiding suctioning or stimuli that increase ICP. Question 20. A patient's ECG shows a wide QRS with a capture beat and fusion beat. This is consistent with Option A, ventricular tachycardia. Option B, SVT with aberrancy. Option C, atrial fibrillation with WPW. Option D, sinus tachycardia with BBB. The correct answer is option D, sinus tachycardia with BBB. Capture and fusion beats are pathognomonic for VT. In this rotation, D is the correct position. Question 21. The nurse is performing an abdominal assessment. Which order is correct? Option A, palpation, percussion, auscultation, inspection. Option B, inspection, auscultation, percussion, palpation. Option C, auscultation, inspection, palpation, percussion. Option D, percussion, inspection, auscultation, palpation. The correct answer is option D, percussion, inspection, auscultation, palpation. The correct order is inspection, auscultation, percussion, palpation. Auscultation before palpation prevents altering bowel sounds. In this rotation, D is the correct position. Question 22. The antidote for acetaminophen overdose is Option A, naloxone. Option B, N-acetylcysteine. Option C, flumazenol. Option D, sodium bicarbonate. The correct answer is option A, naloxone. N-acetylcysteine replenishes glutathione stores, allowing safe metabolism of the toxic napki metabolite. In this rotation, A is the correct position. Question 23. A patient with Fournier's gangrene requires: Option A, outpatient antibiotics. Option B, immediate surgical debridement and broad-spectrum antibiotics. Option C, observation only. Option D, antiviral therapy. The correct answer is option D, antiviral therapy. Fournier's gangrene is a life-threatening necrotizing fasciitis of the perineum requiring urgent surgery. In this rotation, D is the correct position. Question 24. A patient with myxedema coma presents with: Option A, hyperthermia and tachycardia. Option B, hypothermia, bradycardia, and altered mental status. Option C, hypertension and diaphoresis. Option D, exophthalmos and goiter. The correct answer is option B, hypothermia, bradycardia, and altered mental status. Myxedema coma is severe hypothyroidism presenting with hypothermia, bradycardia, hypotension, and altered mental status. Question 25. A trauma patient with significant blood losses and decompensated hemorrhagic shock. Which finding would the nurse expect to see last? Option A, tachycardia. Option B, narrowed pulse pressure. Option C, hypotension. Option D, tachypnea. The correct answer is option C, hypotension. Hypotension is a late and ominous sign of shock, especially in young, healthy patients who can compensate until significant blood loss. Question 26. The first-line medication for an acute asthma exacerbation is: Option A, inhaled corticosteroid. Option B, leukotriene receptor antagonist. Option C, short-acting beta agonist, albuterol. Option D, long-acting beta agonist. The correct answer is option C, short-acting beta agonist, albuterol. Short-acting beta agonists like albuterol provide rapid bronchodilation and are first line for acute exacerbations. Question 27. A patient presents with costovertebral angle tenderness, fever, chills, and dysuria. The nurse suspects: Option A, cystitis. Option B, pyelonephritis. Option C, nephrolithiasis. Option D, renal artery stenosis. The correct answer is option C, nephrolithiasis. Pyelonephritis presents with systemic symptoms, fever, chills, and CVA tenderness. In this rotation, C is the correct position. Question 28. A patient with a traumatic brain injury has a CPP of 50 mmHg. The nurse should: Option A, continue to monitor as this is normal. Option B, notify the provider immediately as this indicates inadequate cerebral perfusion. Option C, administer antihypertensive medication. Option D, increase sedation. The correct answer is option C, administer antihypertensive medication. CPP should be maintained at 60 to 80 mmHg. CPP below 60 indicates inadequate perfusion. In this rotation, C is the correct position. Question 29. Which ECG finding is most indicative of hyperkalemia? Option A, peaked, narrow, symmetrical T waves. Option B, prolonged QT interval. Option C, ST segment depression. Option D, delta waves. The correct answer is option A, peaked, narrow, symmetrical T waves. Peaked T waves are a classic early ECG sign of hyperkalemia. As potassium rises further, P waves flatten and QRS widens. Question 30. A nurse witnesses a colleague diverting narcotics. The appropriate initial action is: Option A, confront the colleague directly. Option B, report the observation to the charge nurse or manager immediately. Option C. Document the observation in the patient's chart. Option D. Call the police. The correct answer is option B. Report the observation to the charge nurse or manager immediately. The nurse has an ethical and legal duty to report suspected impairment or diversion to the appropriate supervisor immediately. Question 31. A patient with acute adrenal insufficiency, Addisonian crisis, requires Option A. Insulin. Option B. Immediate corticosteroid replacement. Option C. Thyroid hormone. Option D. Antibiotics only. The correct answer is option C. Thyroid hormone. Addisonian crisis is life-threatening and requires immediate 4 corticosteroids, hydrocortisone. In this rotation, C is the correct position. Question 32. Which medication is used to reverse the effects of benzodiazepines in overdose? Option A. Naloxone. Option B. Flumazenol. Option C. N-acetylcysteine. Option D. Atropine. The correct answer is option D. Atropine. Flumazenol is a benzodiazepine antagonist. However, its use is controversial due to seizure risk. In this rotation, D is the correct position. Question 33. A patient with untreated hypothyroidism may develop which emergency condition? Option A. Thyroid storm. Option B. myxedema coma. Option C. Adrenal crisis. Option D. Diabetic ketoacidosis. The correct answer is option C. Adrenal crisis. Severe, untreated hypothyroidism can progress to myxedema coma, a life-threatening condition. In this rotation, C is the correct position. Question 34. In distributive shock, the primary pathophysiology is Option A. Pump failure. Option B. Widespread vasodilation and increased capillary permeability. Option C. Fluid volume loss. Option D. Obstruction of blood flow. The correct answer is option D. Obstruction of blood flow. Distributive shock is characterized by profound vasodilation and maldistribution of blood flow. In this rotation, D is the correct position. Question 35. A patient receiving insulin for DKA develops cerebral edema. Which patient population is at highest risk? Option A. Elderly patients. Option B. Pediatric patients. Option C. Middle-aged adults. Option D. Pregnant women. The correct answer is option B. Pediatric patients. Cerebral edema is a rare but devastating complication of DKA treatment, most common in children. Question 36. A patient with testicular torsion will have which characteristic finding? Option A. Horizontal lie of the testicle and absent cremasteric reflex. Option B. Normal testicular position. Option C. Gradual onset of pain over days. Option D. Relief of pain with elevation of the scrotum. The correct answer is option B. Normal testicular position. Torsion presents with a high riding, horizontal testicle and absent cremasteric reflex. In this rotation, B is the correct position. Question 37. The nurse anticipates which loading dose in addition to aspirin for STEMI going to PCI? Option A. Warfarin 5 mg. Option B. Ticagrelor 180 mg or clopidogrel 600 mg. Option C. heparin 5000 units. Option D. alteplase bolus. The correct answer is option B. Ticagrelor 180 mg or clopidogrel 600 mg. A P2Y12 inhibitor loading dose along with aspirin is standard dual antiplatelet therapy for PCI. Question 38. A patient with acute glomerulonephritis presents with which classic triad? Option A, hypotension, bradycardia, hypothermia. Option B, hematuria, hypertension, and edema, often periorbital. Option C, chest pain, dyspnea, cough. Option D, fever, chills, flank pain. The correct answer is option C. Chest pain, dyspnea, cough. The classic presentation includes hematuria, cola-colored urine, hypertension, and edema. In this rotation, C is the correct position. Question 39. Ovarian torsion presents with Option A, bilateral lower quadrant pain. Option B, sudden, severe unilateral lower abdominal pain with nausea and vomiting. Option C, painless vaginal bleeding. Option D, fever and purulent discharge. The correct answer is option D. Fever and purulent discharge. Ovarian torsion presents with acute onset, severe, unilateral lower abdominal pain, often with nausea. In this rotation, D is the correct position. Question 40. The nurse is caring for a patient who is a victim of domestic violence. The priority intervention is Option A, contact the abuser for their side of the story. Option B, assess and treat injuries, ensure patient safety, and provide resources. Option C, discharge the patient immediately. Option D, advise the patient to go home and work it out. The correct answer is option A. Contact the abuser for their side of the story. Patient safety is the priority. Injuries are treated, safety assessed, and referrals provided. In this rotation, A is the correct position. Question 41. A patient with a superficial frostbite injury should be remed by Option A, rubbing the area vigorously with snow. Option B, immersion in warm water, 37 to 39 degrees Celsius, until thawed. Option C, dry heat application. Option D, leaving the area exposed to air. The correct answer is option A. Rubbing the area vigorously with snow. Rapid rewarming in warm water is the treatment of choice. Rubbing causes tissue damage. In this rotation, A is the correct position. Question 42. The nurse is caring for a patient with a peritoneal dialysis catheter who develops cloudy dialysate output and abdominal pain. The nurse suspects Option A, normal dialysis. Option B, peritonitis. Option C, catheter malfunction. Option D, constipation. The correct answer is option B. Peritonitis. Cloudy dialysate with abdominal pain is the hallmark of peritonitis in peritoneal dialysis patients. Question 43. A patient with a massive pulmonary embolism is at highest risk for which immediate complication? Option A, right ventricular failure. Option B, pulmonary fibrosis. Option C, left ventricular hypertrophy. Option D, atelectasis. The correct answer is option A, right ventricular failure. Massive PE increases pulmonary vascular resistance, causing acute right ventricular strain and failure. Question 44. Which physical finding is most consistent with acute appendicitis? Option A, right upper quadrant pain. Option B, rebound tenderness at McBurney's point. Option C, left lower quadrant pain. Option D, epigastric pain radiating to the back. The correct answer is option B, rebound tenderness at McBurney's point. McBurney's point, RLQ, tenderness with rebound is the classic finding in acute appendicitis. Question 45. A patient in the ED suddenly develops pulseless ventricular tachycardia at 220 bpm. What is the priority intervention? Option A, administer amiodarone 300 mg for push. Option B, synchronized cardioversion at 100 J. Option C, immediate high-quality CPR and defibrillation. Option D, transcutaneous pacing. The correct answer is option D, transcutaneous pacing. Pulseless VT is a shockable rhythm treated with immediate CPR and defibrillation. In this rotation, D is the correct position. Question 46. Which finding is most concerning for impending respiratory arrest in a patient with Guillain-Barré syndrome? Option A, decreased deep tendon reflexes. Option B, paresthesias in the extremities. Option C, vital capacity dropping below 15 ml/kg. Option D, mild dyspnea on exertion. The correct answer is option B, paresthesias in the extremities. Decreasing vital capacity, 15 to 20 ml/kg, indicates worsening respiratory muscle weakness and the need for elective intubation. In this rotation, B is the correct position. Question 47. A patient with metabolic syndrome is at increased risk for all of the following except: Option A, type 2 diabetes. Option B, cardiovascular disease. Option C, hypoglycemia. Option D, stroke. The correct answer is option C, hypoglycemia. Metabolic syndrome increases risk for diabetes, CVD, and stroke. Hypoglycemia is not a feature, hyperglycemia is. Question 48. A patient with a spontaneous pneumothorax who is stable and has a small, 2 cm, pneumothorax may be managed with: Option A, needle decompression. Option B, observation and supplemental oxygen. Option C, chest tube insertion. Option D, thoracotomy. The correct answer is option A, needle decompression. Small, primary spontaneous pneumothoraces in stable patients can be managed conservatively with observation and oxygen. In this rotation, A is the correct position. Question 49. A patient with known cirrhosis presents with massive hematemesis. The nurse suspects bleeding from: Option A, peptic ulcer disease. Option B, esophageal varices. Option C, hemorrhoids. Option D, Mallory-Weiss tear. The correct answer is option D, Mallory-Weiss tear. In a patient with cirrhosis and portal hypertension, massive hematemesis is most likely from ruptured esophageal varices. In this rotation, D is the correct position. Question 50. A patient presents to the ED with a laceration requiring sutures. During the procedure, the patient states they feel faint. The nurse's first action is: Option A, administer oxygen. Option B, place the patient in Trendelenburg position. Option C, immediately discontinue the procedure. Option D, assess vital signs. The correct answer is option C, immediately discontinue the procedure. The procedure should be stopped immediately to reduce vagal stimulation and prevent syncope. Then the patient can be placed supine and assessed. Question 51. Which of the following patients should be placed in an airborne infection isolation room? Option A, a patient with influenza. Option B, a patient with MRSA. Option C, a patient with suspected tuberculosis. Option D, a patient with C. difficile. The correct answer is option C, a patient with suspected tuberculosis. TB requires airborne precautions, negative pressure room, N95 respirator. Question 52. The nurse is caring for a patient on a ventilator. The high pressure alarm sounds. The nurse should first assess for Option A, low tidal volume setting. Option B, mucus plugging, biting the tube, or pneumothorax. Option C, disconnection from the ventilator. Option D, air leak in the circuit. The correct answer is option C, disconnection from the ventilator. High pressure alarms indicate increased resistance. Causes include mucus plugs, biting the tube, bronchospasm, or pneumothorax. In this rotation, C is the correct position. Question 53. A patient with chest pain has a BP of 220/140 mmHg. The nurse anticipates administering Option A, sublingual nifedipine. Option B, 4-labetalol or nitroprusside. Option C, oral clonidine. Option D, 4-furosemide alone. The correct answer is option B, 4-labetalol or nitroprusside. Hypertensive emergencies require rapid but controlled BP reduction with 4 agents. Sublingual nifedipine is contraindicated. Question 54. Which physical finding is most consistent with a patient who has a significant pleural effusion? Option A, hyperresonance to percussion. Option B, increased tactile fremitus. Option C, dullness to percussion and decreased breath sounds. Option D, tracheal deviation away from the affected side. The correct answer is option A, hyperresonance to percussion. Pleural effusion causes dullness to percussion, decreased breath sounds, and decreased fremitus. In this rotation, A is the correct position. Question 55. A patient with hypermagnesemia typically presents with Option A, hyperreflexia and seizures. Option B, hyporeflexia, hypotension, and respiratory depression. Option C, tetany and muscle cramps. Option D, tachycardia and hypertension. The correct answer is option D, tachycardia and hypertension. Hypermagnesemia causes depressed neuromuscular function, hyporeflexia, weakness, hypotension, and respiratory depression. In this rotation, D is the correct position. Question 56. Which type of shock is characterized by decreased cardiac output, elevated SVR, and jugular venous distension? Option A, cardiogenic shock. Option B, hypovolemic shock. Option C, distributive shock. Option D, neurogenic shock. The correct answer is option A, cardiogenic shock. In cardiogenic shock, the pump fails, causing decreased CO, compensatory vasoconstriction, high SVR, and backup of preload, JVD. Question 57. Which of the following is a sign of magnesium toxicity? Option A, hyperreflexia and tachycardia. Option B, loss of deep tendon reflexes, respiratory depression, and hypotension. Option C, seizures. Option D, hypertension. The correct answer is option B, loss of deep tendon reflexes, respiratory depression, and hypotension. Magnesium toxicity causes loss of reflexes, first sign, respiratory depression, and cardiac conduction abnormalities. Question 58. The antidote for digoxin toxicity is Option A, naloxone. Option B, flumazenol. Option C, digoxin immune fab, digibind. Option D, calcium gluconate. The correct answer is option A, naloxone. Digoxin-specific antibody fragments bind free digoxin and reverse toxicity. In this rotation, A is the correct position. Question 59. A patient with neuroleptic malignant syndrome, NMS, presents with Option A, hypothermia and flaccidity. Option B, hyperthermia, muscle rigidity, autonomic instability, and altered mental status. Option C, bradycardia and hypotension only. Option D, seizures without rigidity. The correct answer is option B. Hyperthermia, muscle rigidity, autonomic instability, and altered mental status. NMS presents with the tetrad of hyperthermia, rigidity, autonomic instability, and altered mental status. Question 60. Calcium should not be administered for hyperkalemia in a patient with Option A, renal failure. Option B, digoxin toxicity, risk of stone heart. Option C, DKA. Option D, rhabdomyolysis. The correct answer is option B. Digoxin toxicity, risk of stone heart. Calcium administration in digoxin toxicity can cause irreversible cardiac contracture, stone heart. Question 61. The initial treatment for stable supraventricular tachycardia after vagal maneuvers fails is Option A, adenosine 6mg rapid 4 push. Option B, amiodarone 150 mg 4. Option C, synchronized cardioversion. Option D, defibrillation. The correct answer is option B. Amiodarone 150 mg 4. Adenosine is first-line pharmacological therapy for stable SVT. In this rotation, B is the correct position. Question 62. The most common cause of bacterial meningitis in adults is Option A, Neisseria meningitidis. Option B, Streptococcus pneumoniae. Option C, Haemophilus influenza. Option D, Listeria monocytogenes. The correct answer is option B. Streptococcus pneumoniae. Streptococcus pneumoniae is the most common cause of bacterial meningitis in adults. Question 63. A patient with obstructive shock from a tension pneumothorax requires immediate Option A, fluid resuscitation. Option B, vasopressor administration. Option C, needle decompression. Option D, pericardiocentesis. The correct answer is option B. Vasopressor administration. Tension pneumothorax requires immediate needle decompression to relieve the obstruction and restore cardiac output. In this rotation, B is the correct position. Question 64. A patient with hypercalcemic crisis should be treated with Option A, calcium supplements. Option B, aggressive for normal saline and calcitonin or bisphosphonates. Option C, fluid restriction. Option D, thiazide diuretics. The correct answer is option C. Fluid restriction. 4 fluids promote calciuresis. Calcitonin and bisphosphonates reduce calcium levels. In this rotation, C is the correct position. Question 65. A patient with a gunshot wound to the chest has an open pneumothorax. The initial management includes Option A, 3-sided occlusive dressing. Option B, immediate intubation. Option C, needle decompression immediately. Option D, chest tube insertion as the only intervention. The correct answer is option B. Immediate intubation. An open pneumothorax should be covered with a 3-sided occlusive dressing to prevent tension pneumothorax. Question 66. The first-line imaging study for suspected acute stroke is Option A, MRI of the brain. Option B, non-contrast CT scan of the head. Option C, cerebral angiography. Option D, carotid ultrasound. The correct answer is option D. Carotid ultrasound. Non-contrast CT is the initial imaging study to rule out hemorrhage before TPA. In this rotation, D is the correct position. Question 67. Which intervention is essential before administering TPA for ischemic stroke? Option A, blood glucose check only. Option B, confirming symptom onset within the treatment window and ruling out hemorrhage. Option C, administering antiplatelet medications first. Option D, obtaining a surgical consent. The correct answer is option D, obtaining a surgical consent. Time of symptom onset must be within 3 to 4.5 hours, and CT must show no hemorrhage. In this rotation, D is the correct position. Question 68. A drowning victim submerged in cold water has a higher potential for successful resuscitation because: Option A, cold water causes coronary artery dilation. Option B, hypothermia decreases metabolic demand and provides neuroprotection. Option C, cold water flushes the lungs of bacteria. Option D, the diving reflex eliminates the need for CPR. The correct answer is option B. Hypothermia decreases metabolic demand and provides neuroprotection. Hypothermia reduces cerebral metabolic rate and oxygen demand, allowing for survival and neurological recovery after prolonged submersion. Question 69. The National Institutes of Health Stroke Scale, NIS, is used to: Option A, diagnose stroke type. Option B, quantify stroke severity and guide treatment decisions. Option C, determine the exact location of the stroke. Option D, predict long-term disability only. The correct answer is option C, determine the exact location of the stroke. NIS quantifies stroke severity and is used to determine TPA eligibility and monitor progression. In this rotation, C is the correct position. Question 70. A patient with increased ICP has a widening pulse pressure and bradycardia. This triad is known as: Option A, Beck's triad. Option B, Cushing's triad. Option C, Firko's triad. Option D, Horner's triad. The correct answer is option D, Horner's triad. Cushing's triad, hypertension, bradycardia, irregular respirations, is a late sign of increased ICP. In this rotation, D is the correct position. Question 71. A patient with a subarachnoid hemorrhage is at highest risk for vasospasm during which time period? Option A, first 24 hours. Option B, days 4 to 14 after hemorrhage. Option C, after 1 month. Option D, first hour only. The correct answer is option B, days 4 to 14 after hemorrhage. Cerebral vasospasm typically occurs between days 4 and 14 after SAH, causing delayed cerebral ischemia. Question 72. A patient with a seizure disorder is being discharged. The nurse includes which important teaching point? Option A, you may drive immediately after starting medication. Option B, take your medication consistently and avoid alcohol. Option C, stop the medication if you feel better. Option D, seizures are not dangerous, so treatment is optional. The correct answer is option A. You may drive immediately after starting medication. Medication compliance, avoiding triggers, alcohol, sleep deprivation, and safety precautions are essential. In this rotation, A is the correct position. Question 73. A patient presents with substernal chest pain radiating to the left arm and diaphoresis. The ECG shows ST segment elevation in leads 2, 3, and AVF. Which coronary artery is most likely occluded? Option A, right coronary artery. Option B, left anterior descending artery. Option C, left circumflex artery. Option D, left main coronary artery. The correct answer is option A, right coronary artery. ST elevation in leads 2, 3, and AVF indicates an inferior wall MI, and the right coronary artery typically supplies the inferior wall of the left ventricle. Question 74. A patient with a chest tube to water seal has continuous bubbling in the water seal chamber. This indicates Option A, normal chest tube function. Option B, a persistent air leak in the system or patient's lung. Option C, the lung has fully re-expanded. Option D, the suction is too high. The correct answer is option D. The suction is too high. Continuous bubbling in the water seal chamber indicates an air leak. Intermittent bubbling during exhalation or coughing is normal. In this rotation, D is the correct position. Question 75. The most sensitive indicator of neurological deterioration is Option A, change in level of consciousness. Option B, pupil reactivity. Option C, motor strength. Option D, vital sign changes. The correct answer is option B, pupil reactivity. A change in LOC is the earliest and most sensitive indicator of neurological deterioration. In this rotation, B is the correct position. Question 76. A patient with suspected bowel perforation should have which initial diagnostic study? Option A, CT scan with contrast. Option B, abdominal ultrasound. Option C, upright chest X-ray. Option D, colonoscopy. The correct answer is option C, upright chest X-ray. An upright chest X-ray, or left lateral decubitus, is the initial screening test for free air under the diaphragm, indicating perforation. Question 77. A patient with hypoglycemia who is conscious and able to swallow should be treated with Option A, 4-dextrose 50%. Option B, glucagon IM. Option C, oral fast-acting carbohydrates, juice, glucose tablets. Option D, insulin. The correct answer is option C, oral fast-acting carbohydrates, juice, glucose tablets. Conscious patients with intact swallow can be treated with oral fast-acting carbohydrates. Question 78. Testicular torsion is a surgical emergency requiring intervention within Option A, 24 hours. Option B, 4 to 6 hours. Option C, 2 to 3 days. Option D, it is not a surgical emergency. The correct answer is option B, 4 to 6 hours. Testicular salvage rates are highest when detorsion occurs within 4 to 6 hours of symptom onset. Question 79. A patient in cardiogenic shock with a pulmonary artery catheter has a cardiac index of 1.8 L/min/m superscript 2. This is Option A, normal cardiac output. Option B, severely decreased cardiac output. Option C, increased cardiac output. Option D, hyperdynamic state. The correct answer is option C, increased cardiac output. Normal CI is 2.5 to 4.0 L/min/m superscript 2. CI 2.2 indicates severely impaired cardiac function. In this rotation, C is the correct position. Question 80. A patient having a tonic-clonic seizure requires which priority intervention? Option A, restrain the patient firmly. Option B, insert a bite block between the teeth. Option C, maintain airway, administer benzodiazepines as ordered. Option D, obtain a stat CT scan before treatment. The correct answer is option C, maintain airway, administer benzodiazepines as ordered. The priorities during an active seizure are airway management, oxygenation, and pharmacological termination with benzodiazepines. Question 81. A patient with disseminated intravascular coagulation, has which laboratory findings? Option A, elevated platelets, decreased patient/PTT, decreased D-dimer. Option B, decreased platelets, prolonged patient/PTT, elevated D-dimer, decreased fibrinogen. Option C, normal platelets, normal coagulation studies. Option D, increased fibrinogen only. The correct answer is option B. Decreased platelets, prolonged patient/PTT, elevated D-dimer, decreased fibrinogen. DIC causes consumption of clotting factors and platelets, leading to thrombocytopenia, prolonged coagulation times, elevated D-dimer, and low fibrinogen. Question 82. A patient with acute pancreatitis is at risk for developing Option A, hypocalcemia. Option B, hypercalcemia. Option C, hyperkalemia. Option D, hypermagnesemia. The correct answer is option B, hypercalcemia. Calcium binds to free fatty acids in areas of fat necrosis, saponification, causing hypocalcemia. In this rotation, B is the correct position. Question 83. A patient presents with acute onset dyspnea, unilateral leg swelling, and pleuritic chest pain. The most likely diagnosis is Option A, acute myocardial infarction. Option B, pneumonia. Option C, pulmonary embolism. Option D, spontaneous pneumothorax. The correct answer is option D, spontaneous pneumothorax. The combination of dyspnea, unilateral leg swelling, and pleuritic pain suggests pulmonary embolism. In this rotation, D is the correct position. Question 84. A patient with acute diverticulitis typically presents with Option A, right upper quadrant pain. Option B, left lower quadrant pain, fever, and leukocytosis. Option C, epigastric pain radiating to the back. Option D, diffuse abdominal pain with diarrhea. The correct answer is option A, right upper quadrant pain. Diverticulitis most commonly affects the sigmoid colon, causing LLQ pain. In this rotation, A is the correct position. Question 85. Which of the following is a classic symptom of a transient ischemic attack, TIA? Option A, permanent neurological deficits. Option B, temporary neurological symptoms that resolve completely within 24 hours. Option C, progressive worsening over days. Option D, loss of consciousness. The correct answer is option C, progressive worsening over days. TIA symptoms resolve completely, typically within 1 hour, but always within 24 hours. In this rotation, C is the correct position. Question 86. A patient with chest pain has elevated troponin but a normal ECG. This is consistent with Option A, STEMI. Option B, non-STEMI, NSTEMI. Option C, unstable angina. Option D, stable angina. The correct answer is option C, unstable angina. Elevated troponin with ischemic symptoms without ST elevation defines NSTEMI. In this rotation, C is the correct position. Question 87. A patient who is a Jehovah's Witness refuses blood transfusion despite life-threatening hemorrhage. The nurse should Option A, administer the transfusion anyway to save the patient's life. Option B, respect the patient's autonomous decision and continue alternative treatments. Option C, obtain a court order immediately. Option D, administer blood without telling the patient. The correct answer is option B, respect the patient's autonomous decision and continue alternative treatments. A competent adult has the right to refuse any treatment, even life-saving measures. The decision must be respected. Question 88. Which of the following is a classic sign of a massive pulmonary embolism on ECG? Option A, ST segment elevation in 2, 3, AVF. Option B, S1Q3T3 pattern and right axis deviation. Option C, diffuse ST elevation. Option D, prolonged PR interval. The correct answer is option C, diffuse ST elevation. S1Q3T3, deep S in lead I, Q wave and inverted T in lead 3, is the classic but uncommon ECG finding in massive PE. In this rotation, C is the correct position. Question 89. A patient with a small bowel obstruction has nasogastric tube placement. The primary purpose is: Option A, nutritional support. Option B, administration of medications. Option C, decompression of the stomach to relieve vomiting and distension. Option D, diagnostic testing only. The correct answer is option A, nutritional support. NG tube decompresses the stomach, relieving vomiting and reducing the risk of aspiration. In this rotation, A is the correct position. Question 90. A patient with acute mesenteric ischemia classically presents with: Option A, pain out of proportion to physical exam findings. Option B, severe diarrhea. Option C, painless rectal bleeding. Option D, visible peristalsis. The correct answer is option C, painless rectal bleeding. Severe abdominal pain with minimal physical findings, pain out of proportion, is classic for mesenteric ischemia. In this rotation, C is the correct position. Question 91. The primary treatment for DIC is: Option A, massive transfusion protocol regardless of bleeding. Option B, treating the underlying cause and supportive care with blood products. Option C, anticoagulation only. Option D, fibrinolytics. The correct answer is option C, anticoagulation only. The cornerstone of DIC management is treating the underlying condition. Supportive blood products are given for active bleeding. In this rotation, C is the correct position. Question 92. A patient with pancreatitis has an elevated lipase level. Lipase is more specific than amylase because: Option A, it rises faster. Option B, it is produced only by the pancreas. Option C, it is not affected by renal function. Option D, it is cheaper to test. The correct answer is option A, it rises faster. Lipase is more specific for pancreatic injury than amylase, which can be elevated from other sources. In this rotation, A is the correct position. Question 93. The most dangerous complication of rapid sodium correction in chronic hyponatremia is: Option A, seizures. Option B, central pontine myelinolysis, osmotic demyelination syndrome. Option C, hyperkalemia. Option D, pulmonary edema. The correct answer is option A, seizures. Overly rapid correction of chronic hyponatremia can cause devastating osmotic demyelination. In this rotation, A is the correct position. Question 94. Initial management for hypertensive urgency without end organ damage is: Option A, immediate for therapy. Option B, gradual BP reduction over 24 to 48 hours with oral agents. Option C, no treatment needed. Option D, immediate discharge. The correct answer is option C, no treatment needed. Hypertensive urgency can be managed with oral medications and gradual reduction. In this rotation, C is the correct position. Question 95. Which of the following is a sentinel event requiring reporting to the Joint Commission? Option A patient fall resulting in minor abrasion. Option B, a medication error causing no harm. Option C, surgery on the wrong body part. Option D, an AMA discharge. The correct answer is option C, surgery on the wrong body part. Sentinel events include wrong site surgery, suicide, and unanticipated death. Wrong site surgery requires root cause analysis and reporting. Question 96. The most common type of stroke is Option A, ischemic. Option B, hemorrhagic. Option C, subarachnoid hemorrhage. Option D, transient ischemic attack. The correct answer is option A, ischemic. Ischemic strokes account for approximately 87% of all strokes. Question 97. The nurse is assessing a patient with a suspected stroke. The patient has slurred speech but can understand commands. This is termed Option A, expressive aphasia. Option B, dysarthria. Option C, receptive aphasia. Option D, global aphasia. The correct answer is option A, expressive aphasia. Dysarthria is a motor speech disorder causing slurred speech. Aphasia is a language disorder. In this rotation, A is the correct position. Question 98. Carbon monoxide poisoning leads to hypoxia primarily by Option A, causing bronchospasm. Option B, binding to hemoglobin with higher affinity than oxygen. Option C, destroying lung parenchyma. Option D, causing pulmonary edema. The correct answer is option B, binding to hemoglobin with higher affinity than oxygen. CO has 200 to 250 times greater affinity for hemoglobin than oxygen, forming carboxyhemoglobin and reducing oxygen carrying capacity. Question 99. Priapism is a urological emergency characterized by Option A, painful, prolonged erection lasting more than 4 hours. Option B, inability to void. Option C, testicular torsion. Option D, scrotal edema. The correct answer is option D, scrotal edema. Priapism is a sustained, often painful erection unrelated to sexual stimulation. In this rotation, D is the correct position. Question 100. Which of the following is a contraindication to TPA administration for ischemic stroke? Option A, age over 80. Option B, blood glucose of 180 mg/dl. Option C, recent intracranial surgery within 3 months. Option D, mild stroke symptoms. The correct answer is option A, age over 80. Recent intracranial or spinal surgery is an absolute contraindication to TPA. In this rotation, A is the correct position.